The WHO Europe application on primary healthcare for children and adolescents offers evidence-based guidance and tools for doctors, nurses, and other health workers who are responsible for caring for children and adolescents in primary care settings. This app is based on the Pocketbook for Primary Healthcare for Children and Adolescents, developed by the WHO Office on Quality of Care and Patient Safety in Athens in 2022. Learn more about the different features by clicking on the icons at the bottom of your screen. By clicking on the home icon, you can access all of the Pocketbook's content. The colors in the app reflect the color coding used in the Pocketbook, making it easy to navigate. In the top right corner, you can find information for urgent cases, including vital signs and drugs to be used in emergencies. When opening a chapter, you will see a list of subheadings. By default, they are organized according to the chapters in the paper version, but you can also choose to sort them alphabetically. Some chapters have subsections that can be opened by clicking on the arrow. You can open and zoom in on the images. No need to return to the home screen to explore a particular topic of interest. A simple click on a link will take you directly to that section. You can also create bookmarks for your favorite topics. To do so, highlight the desired text and press the favorites icon in the bottom right corner. You can add a description to this bookmark to easily find it later. The second tab gives you access to all the counseling boxes, displayed in the same color as the chapter where the condition they refer to is mentioned. You will find important messages summarized for you in easy language adapted for children, adolescents, and their caregivers, so they will understand the guidance. In some of the counseling boxes, you can personalize the content by adding, for example, a specific drug and appropriate dosage according to the child's weight. You can export each counseling box into PDF format and send it to adolescents, parents, and caregivers, or save it on your own device. The third tab at the bottom of the landing page leads to a series of calculators and other useful tools to support health providers in their work, improving quality of care and patient safety, and reducing unnecessary use of antibiotics. For example, you can use the calculator to determine drug dosages according to the child's body weight. Here's how. Select the drug you intend to prescribe, either by scrolling down the list or by directly typing the first letters of its name. Enter the child's weight, then click on the button to receive the correct drug dosage. For instance, when prescribing paracetamol to a child of 11 kilograms, you can choose to give syrup with a concentration of 120 milligrams per 5 ml. In this case, the app will indicate that 5 ml is needed every 4 to 6 hours. Alternatively, rectal administration might be required, in which case the app indicates that one suppository of 100 milligrams is to be administered every 4 to 6 hours. For some drugs, different dosages are required depending on the diagnosis or condition of the child. In this case, look at the indication at the top of each box. For amoxicillin, for example, 25 milligrams per kilogram are needed twice a day for most of its indications. An 11-kilogram child needs 6 ml of syrup with that concentration. However, in the case of pneumonia, the same child needs a higher dosage, as indicated in the box below, requiring 7.5 ml of syrup 3 times a day. You can also track growth monitoring for a specific child by entering sex, date of birth, weight, length or height, and head circumference. This tool immediately provides the nutritional status that can be seen on the WHO growth charts. There is a separate tool to calculate the body mass index. Other tools will help you determine the severity of asthma exacerbation, for example, or the level of dehydration, indicating the corresponding treatment. Take some time to discover all the different tools the app has to offer in this section. The Favorites section allows you to group and save important information in one place. Here, you will find all the notes and links you have already created. To edit an existing note, swipe right, make your changes, but make sure to click Save. To delete a note, swipe left, and the trash button will appear on the right side of the note. You can also create a customized note without linking it to any content by simply adding the title and text. You can sort your notes alphabetically or by date of creation. The Settings tab will help you tailor and improve your experience. Be sure to save your changes using the button at the bottom. Currently, the app is available in English. Additional language versions will be made available at a future date. Here, you can list useful phone numbers of colleagues, specialists, and other professionals who you are working with to provide the best care for children and adolescents in your community. Keep all useful contacts handy for use at any time. There is also a list of abbreviations used in the app. Finally, there is a search function. Click on the button at the top right of your screen and enter a keyword to bring up results. The app works in both portrait and landscape mode, making it convenient to use on different devices. This also makes it easier to see the content of tables and algorithms. We are committed to improving this app further. Please let us know your feedback and ideas for improvement. We hope the app will be useful for you, your colleagues, and prove a useful tool in improving the care for children and adolescents across the WHO European region and beyond.